Namaste. Welcome you all for the yoga session. We have been focusing on the pelvic health. This is the second in the series. Pelvis is among the four major cavities we have. The pelvic cavity is the lowermost located adjacent to the groin, and it majorly houses the urogenital organs, and that's why it's very important to nourish that place. So some of the stretching and breathing techniques we are going to explore towards that, and for today's class you should have couple of blankets and a dupatta. If you have belt, yoga belt, that is also good, but dupatta, I think, easy to find. So first we will begin with the basics. Lie on your back, fold both legs, heels closer to the hips. Press the feet. Right palm on the abdomen, left palm on the chest. As we inhale, the bottommost portion of the abdomen, that is pelvis, and then the middle of the abdomen, then top of the abdomen should expand all around. As we exhale, it should contract. Chest as neutral as possible. And then watch the transition between inhalation, exhalation, and exhalation, inhalation. Breathe slowly, steadily. Try to make the exhalation little longer than inhalation, if possible. So as we inhale and exhale, right palm should move up and down respectively. Left palm remains stable. Stretch both arms up. Raise your right leg up. Pull the kneecap, stretch the heel. Feel the stretch at the back of the thigh and the calf. Toes towards the knee. Down. Left leg up. Press the right foot, tighten the back of the right thigh. Down. Right leg again. Pull the kneecap, stretch the toes towards the knee. Feel your hip, feel your pelvis in particular. Down. Left leg. Pull the kneecap. Watch your back muscles, watch your breathing. Down. The next one, right leg up. Fold. Hold the knee. Press the knee closer to the chest. Again, stretch the toes towards the knee. Press the left foot. Tighten the back of both the thighs. Pull the knee closer to chest. Feel your breathing. Release right leg. Change. Left leg up. Fold. Hold the knee. Press the knee closer to the chest. Feel the pressure of the thigh on the abdomen as we inhale and exhale. Especially feel your pelvis. How does it feel? When you inhale and exhale, release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. Release right leg. Change. Left leg. Fold. Hold the knee. Press the knee closer to the chest. Watch your gluteal muscles and back muscles. down. The next one, right leg up. Fold it across in Padmasana. Take the heel as close to the root of the left thigh as possible. Stretch the toes up. Push the knee back. Tighten the back of both the thighs. Feel the knee capsules. Feel the pelvis, the right portion and the left portion. Release right leg. Chain. Left leg up. Fold Padmasana. Feel the root of the thigh groins on both the side and feel your sacrum. Sacrum is that flat bony surface. It's a part of the spinal column just below the lower back, just where the hips open. Release left leg. One more time. Right leg up, fold it across. Release right leg. Chain. Left leg up. Fold it across. Push the knee. Watch your breathing. Pay attention. Down. The next one, right leg up, fold from left hand, hold the ankle joint, pull it from right hand, push the knee across the chest. So you are stretching the gluteal maximus muscle. Release right leg. Chain. Left leg up. Fold. Hold the ankle joint from right hand. Pull it. Stretch the toes up from the left hand. Push the knee across the chest. Feel your hips, lower back. Release left leg. One more time, right leg up. Fold. Pull the ankle joint. Push the knee. Release right leg. Chain. Left leg up. Hold the ankle joint from right hand, pull it, push the knee across the chest. All these movements are also essentially good for the pelvic cavity because hip is a very close neighbor, or actually an integral part of your pelvis. So any of these movements would greatly help in relieving the stiffness in the pelvis. Down. Now we will do a couple of stretch using the dupatta. Hold from both hands. Put the dupatta to the sole of the right foot. That is the metatarsals. Sole there. You have to put. Hold both edges of the dupatta and straighten the right leg. So you can pull the sole of the foot down, push the knee back, pull the kneecap. Ensure that the sacrum is resting on the floor. Keep on pulling the kneecap. Breathe abdominally, especially feel the pelvis. Right leg down. Chain. Left leg. Put it to the sole of the foot, stretch, pull the kneecap. Down. We'll do one more type in this. Put the dupatta to the front of the foot. Straighten the right leg. Pull the kneecap. Stretch the toes towards the knee. Now hold both ends of the dupatta from your right hand. You can flex the right elbow. Then slowly, gently move the right leg straight and to right side. Rest the right elbow. So that means that you should not go completely like this. This should not roll out. The pelvis should not roll out. So just keep your left hand on your pelvis to ensure that it's not turning out. Keep on pulling the kneecap. Feel the pelvis, the left side, right side. How do they feel? Now slowly bring your right leg up. Hold dupatta from both hands. Release right leg. Chain. Left leg up. Pull the kneecap. Stretch the heel. Hold both ends of dupatta from your left hand. Right hand on the pelvis. Slowly move the left leg to the left side. Press the right elbow on the floor. You should push the foot against the dupatta so that you can straighten it. You can straighten the leg better. And you must feel that stretch transmitting all the way to the root of the thigh. And breathe deeply and watch your pelvis. Slowly bring your left leg up. Hold the dupatta from both hands. Release left leg. This is an important movement. We shall repeat. Dupatta to the front of the foot. You should understand why we are putting at the front of the foot is because you can get a better dorsiflexion of the ankle joint, and that would enhance the stretch in the calf muscle and the hamstrings, back of the thigh. And you must pull the foot. Now hold both edges from right hand. Slowly move the right leg to the right side. Press the right elbow on the floor and further stretch. And as you stretch, try to see that you flatten the sacrum onto your mat. Feel the root of the thigh, stretch well. Be aware of your breathing. Bring your right leg up. Hold the dupatta, release right leg, chain. Left leg up, left leg straight, pull the kneecap. Hold both ends of the dupatta from left hand. Right hand on the pelvis. Move your left leg to the left side. Straighten the leg and push the pelvis further down. Press the right foot, activate the right thigh. Don't forget that. Now slowly bring your left leg up, down. Keep the dupatta to your side and then slowly get up, sit upright. Let us fold this blanket. take one more blanket and stack both the blankets. So you will have a better height. Maybe about 3 to 4 inches. Now sit upright on that. Hips on the blanket, foot on the mat. So see, the pelvis is actually tilted like this. So now when you sit at a height, it further assists freedom at the pelvis. So as opposed to, for example, sitting like this, there is congestion here. When you sit up, hips at a height, legs down, you see more space. And you can also straighten the spinal column properly. So we will do a simple twisting posture. So we shall do Bharadwajasana. Take both the foot to the left side. So hips on the blanket at height, then legs on the mat. Thighs should run parallel in the forward direction. Sit upright. Now left hand on right knee, right hand fingertips on the floor. Inhale, exhale, turn. Turn the tongue, turn the neck also in the direction of the twist. Breathe well. Watch your breathing. Especially sensitize your pelvis. Slowly come to the center and change. Both foot to your right side, right hand on left knee, left hand fingertips on the floor. Inhale, exhale, turn. Slowly come to the center, sit in Swastikasana. Now sit in Baddha Konasana, join the feet, press the knee as close to the ground as possible. So this is a good pelvis opener. Baddha Konasana is a very, very useful posture. Breathe abdominally. So as you inhale, you must feel the boundaries of the pelvis. Bottommost you have a diaphragm, a small diaphragm that also responds to breathing. Just like the main diaphragm here, at the bottom also there is a small diaphragm. That is actually the floor of the pelvis. Levator any muscles. So watch that. Then watch the groin. Then watch the sacrum at the back. Then pubic region at the front. And of course, the pelvic rim here. So learn to sensitize the complete region. You have to irrigate that region through your breathing. Now join the legs. We will do some variations with this Baddha Konasana. The first one is a simple backward bend. Supta Baddha Konasana. Keep both the blankets like this. Now what we are going to do is sit on it, then lie down back. But the sacrum should be here. Sacrum is this flat bony region that just when the hips begin to open in that region and below the lower back. You can feel that it is a very prominent bony area. That is a part of the spinal column which actually articulates with your pelvic rim. So the iliac bones. So sit on the mat, take the palms back, with the support of the arms, gently lie down. Now when you lie down, don't go like this. The chest and abdomen should not sink. You raise them up. Then only that sacrum can sit flat on the blanket. Ensure that you have done that. So this is raising the chest and abdomen we should do. The lifting up of the pelvis, the support will take care. So now we will feel a longitudinal stretch in your pelvis because of the support of the blanket. Now join both the feet and drop the knee. So now you also get a lateral stretch. So rise the navel and chest up. Chest to the chin. try to drop the knee as much as possible so that the pelvis gets a good stretch. So sacrum is propped up, so pelvis opens out. And Baddha Konasana further helps the lateral stretch, and by way of lifting the navel and chest, you are enabling further longitudinal stretch. Now stretch both arms up. Press the feet. Now you have to very intelligently use your breathing. As you inhale the bottommost portion, that is the pelvis, should expand. As it expands, you should feel the bottommost portion, and then the sides, then the front and the back. The expansion should reach all these regions. Similarly, as we exhale, it should contract. Internally, see, the bone will not shrink. The cavity itself will not expand and shrink. It is actually the inside, the viscera inside. Learn to watch your breathing, watch the pelvis and abdomen, and take advantage of the posture. Then you must learn to stay in these postures at least 3 to 5 minutes. Be attentive, be watchful. Slowly inhale, slowly exhale. Learn to exhale it longer than you inhale. Now rise the knee up, press the foot, take the arms down and just slide down, resting the lower back. Now slowly get up from the right side. Sit on the blanket in Swastikasana. Again, Baddha Konasana. Sit upright. From left hand, hold the right foot. Right hand fingertips on the floor, turn. Turn the neck also. Chest and navel up, twist well, breathe well. Slowly come up, then Che. From right palm, hold the left foot, left hand fingertips on the floor in an exhale turn. Special attention to pelvis again, don't forget. Slowly come up, sit in Swastikasana. Now we will do a forward bend with Baddha Konasana. So again, sit at a height, sit in Swastikasana. So we have seen the expansion. Then we did the backward bending for the pelvis. We have seen the twisting. And now we are going to see the forward bending, how it impacts your pelvis. And especially with Baddha Konasana, how you find further lateral expansion of the pelvis. So sit in Baddha Konasana, chest and navel up. Slowly bend forward, stretch the trunk. If possible, rest the forehead on the mat, or you can keep some blankets or even a chair to rest the forehead. Feel your groin, feel your pelvis, watch your breathing. Flex the arms, press the palm. Slowly get up. Sit in Swastikasana. Now we look at the practice of Kapalabhati. Procedure is you have to contract the abdominal muscles with a gentle force, expel the breath quickly, forcefully. Relax the muscles, the air automatically enters in. And in Kapalabhati, we should notice that the lower portion of the abdominal muscles, they are active, then the upper. And sitting at a height will help to enhance that feel. And sitting in Baddha Konasana will further help to feel the lower quadrant of the abdomen, which includes the pelvis. So sit upright, palms facing upward, tip of the thumb and index finger in contact. Watch your breathing. As you inhale, the pelvis and the abdomen should expand. As you exhale, it should contract. Now we are going to do Kapalabhati, and we shall do 60 cycles with gentle force. And we have already explained some cautions, precautions. So be aware of that. If you are new to the practice, do maybe about 10-20 cycles, that's good enough. After 60 cycles, just relax and if possible, feel that state of Kevala Kumbhaka, a deep state of relaxation, where there is neither inhalation nor exhalation nor retention of the breath. So we are going to do 60 times. Contract the abdominal muscles, expel the breath quickly, forcefully. Relax, the air automatically enters in. Forced exhalation, automatic inhalation. Be relaxed. If the groin is paining, you can afford to come to Swastikasana and then again go to Baddha Konasana. We are going to repeat another 60 sets of Kapalabhati. Be gentle, don't use undue force. We can start now. Be relaxed. Open your eyes, sit in Swastikasana. Push the blankets back. Now lie on your chest. We'll do Makarasana. Spread the feet about 1.5 to 2 feet away, apart. Toes turned out. Palms folded. Neck to a side. Just be relaxed. Breathe normally. Watch your pelvis. Feel your sacrum. Feel the complete pelvic rim. Breathing should be very normal, natural. Feel your buttocks. This is an excellent relaxation posture, but you must be aware, so you don't sleep. You must be watching your breath. Now join the feet. Press the palm. Slowly get up from the right side. Sit in Swastikasana. Salutation to Sage Patanjali. In the next class also, please have a dupatta, couple of blankets, and maybe a chair. Any chair will do at your disposal so that we can do some more useful postures for the pelvis. Salutation to Sage Patanjali. Take a deep breath. Yogena jittasya padena vacham bhalam sharirasya cha vaidyakena yopakarottam pravaram muninam patanjalim branjaliranatosmi Hari Om. Shri Krishna Arpanamastu. Shri Gurubhyo Namaha. Shubhamastu.